Hey everyone, welcome back. We're talking about mental health and all things mental health, and we're back to talk with Dr. Xiaojue, who Dr. Hu is a member of our clinical treatment group, but also she's an assistant professor at NYU studying psychedelics. She's a CL trained, consult liaison trained psychiatrist. Xiaojue, welcome back.
Thanks so much, Drew. Happy to be back.
Well, we have another video. If folks haven't seen it, make sure and subscribe below so you don't miss any of our videos. But we were talking in our last video all about the landscape of psychedelic medicine today. And you were talking a little bit about some of your work, both sitting with patients in these treatment trials as they're having experiences. I guess that's psychedelic assisted therapy, but also this other phrase, psychedelic integration. And I don't know a lot about that. And I wanted to just hear more. What is psychedelic integration? How does that fit into these protocols? Because with all the buzz about psychedelics and ketamine and MDMA, I think sometimes people are missing these are psychotherapies, really.
Right. I know it can be a little confusing because I think they're a really unique medicine that we haven't really seen before in conventional psychiatry. So, say in medicine, you're taking Tylenol. It doesn't really matter like what context in which you take Tylenol in. Hopefully, it will give you the same pain relieving, fever relieving effects, no matter if you're in a good mood, bad mood, if you're talking to a therapist. But psychedelics are interesting and special in that their effects really depend on the context in which you use them. And so that's also a unique opportunity to kind of really maximize their therapeutic potential if you can, tweak the context. And that's where psychedelic assisted therapy can come in and also integration. So we talked a little bit last time about set and setting, which, just means, your inner environment, your mindset, your attitudes going in, your beliefs about the medicine, what it can do for you, your psychological history, what you want to work on. And then also the outer context, like, are you doing this alone, tripping in the basement? Are you in the woods
Bad
with
idea. I think that's probably a bad idea, right?
probably a bad idea. Probably a bad idea. I mean, it depends on what you're using. You'll probably live, but um, or are you in a club or are you in a medical setting with like two therapists in a research study? So different contexts will give you different experiences and
I
integration.
always felt like back when I was a younger explorer and in college, being in natural settings was something that people generally would talk about being comfortable with this. And I'm wondering, do people do okay in this kind of, I don't call sterile, but clinical setting where you're in this interior room with nightshades on and I guess headphones, or is it part of the power of these medicines? People really go internal, and having that controlled setting is really helpful.
Yeah, that's a good question. Well, so psychedelics really amplify everything, like external stimuli, internal stimuli. So you can kind of direct the power of them either in the external world, like if you want to explore nature, they're a beautiful tool to kind of really get in touch with nature and stuff like that, or going to museums. But if you want to go inside, then if you're in an environment where you may feel relatively safe and comfortable with eye shades on, then the focus goes inside. So it almost doesn't even matter like physically what's out there as long as you kind of feel safe and comfortable. Um, and that's sort
That's
of
really, I think a really important. This is maybe a bad analogy, but it reminds me of sometimes when patients with ADHD, instead of doing their homework when they take a stimulant, end up on a deep rabbit hole of the internet or doing a lot of shopping, right? Where there's that power, but instead of maybe being directed internally or where it's supposed to be or where it could be, it kind of maybe gets distracted by things externally.
exactly.
So people have this very internal experience, and you're sitting with them, and then it sounds like there are kind of two parts of this. The part that happens as you're with somebody potentially, and a kind of psychedelic assisted. But I'm wondering how the kind of experience, what do people remember, and what do you help them remember, and then what do you, I guess, do with it? Is that the psychedelic integration part?
Right, right. I think that matters a lot, especially if your goal or intention is to kind of get better from, say, your depression or anxiety or PTSD or something. So you sort of have an intention going in. Sometimes psychedelics can bring up a lot of challenging feelings, especially if you've had a history of trauma, which is at the root of so much mental illness. Sometimes psychedelics can help you get in touch with those traumatic moments that maybe you've been avoiding all your life. And a lot of challenging feelings can come up. And so sometimes people may experience a lot of negative feelings, but it's actually part of an overall therapeutic process, because in order to heal something, sometimes you have to feel it first. And so, that's just one version of how a psychedelic trip may go if you're using it therapeutically. And so the integration part might be really important, especially for those challenging experiences, to kind of help you make meaning of like what exactly happened. Say you went
Mhm.
through a really scary trip, you just experienced a whole bunch of painful memories, and then now you're kind of like, you know, everything's opened up. The Pandora box has been opened up within you. And now how are you going to go back to your daily life? How are you going to cope with things now that you maybe remembered something you didn't remember before, or got in touch with difficult feelings? And that's where therapy can really help you kind of reintegrate back into your life, process those feelings, maybe let go of things so that you can kind of move forward in a better way. Yeah.
Thank you for that. That's a really wonderful description of it. I think really makes it clear in terms of, I think, part of the maybe challenging part. And as you're talking about with Tylenol, is we know what's going to happen with Tylenol. We know how it works. We know what the effects will be. Pretty consistent between folks, but with a psychedelic and with a psychedelic experience, you don't know what's going to happen, what content is going to come out, which I think is challenging for people. Can you tell us a little bit about the how you think, and I know there's a hard question, but how you think the difference, there's a pharmacological piece of these agents where there
Right.
seems to be an induction of, I would call it like neuronal sprouting and growth and kind of, I don't know, brain healing and repair. But then
Yeah.
there's also the psychological part where in that initial study that I think Steve Ross and your group did around psychedelics being given to people at the end of life, and
Mhm.
people really having this release and separation from fear, this kind of idea there's a change in the default mode network, which is like our sense of self. And I guess my question is, how do you sit and wrestle with this as a scientist and a researcher, and also somebody really interested in spirituality and psychology and the psyche? What's pharmacological and what's psychological?
Wow. What a big question.
That's such a big question. I'm so sorry.
I'll have to answer it in the next 2 minutes. Yeah, well, I do believe that, a human being exists on many different levels, right? So there is that whole physical level. So maybe maybe you don't remember anything that happened in your psychedelic trip, and you may still have a therapeutic, experience after. You may still feel better afterwards because it's also working on a biological level. They're HT2A receptor agonist, or something. It's a type of serotonin receptor. So there's definitely working on your brain. There's a period, like you mentioned, of neuroplasticity after the trip where your brain, it's almost like getting back to when your brain, how it was when you were a child, when, it's very malleable, very impressionable. So that's the prime time where you could decide, hey, I want to change my life in this specific way. I want to, start these new habits, or I want to think about myself in a different way. I want to tell a different story to myself than what I had been before. That's sort of the best time to do it because your brain is a
Oh,
little
that's so helpful, that because it is this model where we kind of in our field try and separate it, right? Where I
right.
think the most modern way of thinking about things like psychotherapy and psychedelics is this integration of how we can understand our neurobiology and the ways that also in our psychology and our thoughts and who we are, we can shape that. But so the idea is that, in this moment, let's say I went into a trip and I wanted to think about, I don't know, I've seen a lot of talk about addiction and some of these, right? Where people, really want to cut back or stop drinking or stop smoking, right? So the idea is that maybe my brain gets to this state, my default mode network shuts down, that I'm more open to this notion, right? And then the important part of the integration is not just that passes, I go back to work on Monday and it's like, whoa, that was heavy, but that I have a few sessions with you where we talk about, I don't know, that evil bottle that cut me in my experience or something like that, but kind of keep this notion open. So while my brain is kind of in this state over the next couple of weeks or or week, that I'm talking with you about what happened, and my mind is open to those ideas. So I really cement or pull in some changes.
Right. And that's where the integration can be really useful because I think Michael Pollan has this analogy of in his book, How to Change Your Mind, about like fresh snow falling. Like maybe you're living your life in a certain way and you get into this groove where you're always doing the same thing over and over again. And it could be really
Mm-hmm.
hard to get out of those grooves, like with addiction, the compulsion to use and stuff like that. And then psychedelics gives you sort of this reset where like fresh snow has fallen, maybe over the worn tracks of your mind, and you can decide, okay, which road am I going to take now? You can always go back to using too. That's always a choice. But you
Mm-hmm.
can do something different. You can do a million different things. But it just gives you that opportunity to just make a different choice if you want to. And having someone to work with you in that special time period where it's easier to do that can, lead to hopefully tremendous impact down the road for you.
Well, someday when I go on a wild journey, I can't think of a better person to process it than with you, Xiaojue, having spent so much time getting to know you. Well, thank you so much for sharing your thoughts and experiences with this emerging part of our field, psychedelic medicine, or plant medicine, as sometimes it's called, honoring the indigenous roots of a lot of these compounds. And then specifically today, talking about psychedelic integration therapy, how people at the forefront of this are thinking about how talk therapy and talking about these experiences, really kind of married with what we know about the neurobiology, is the most effective way we're seeing these be used. We should note there are these two great trials, I think both coming out of Johns Hopkins, where a protocol about psychedelic integrative therapy, and then Dr. Hu, Xiaojue, is involved with Steve Ross's group at NYU, where they're right in the midst of collecting data and dosing patients with a single dose of psilocybin to treat major depressive disorder. And so anybody who wants to talk with Dr. Hu more about psychedelic medicine, as we've noted in our last video, the only thing that's legal now in the United States is ketamine, but a lot of people have had experiences, and talking about them, processing them can be really helpful in terms of improving your mental health. So you can reach Dr. Hu through our website, drewramseymd.com. And if anybody has any other questions, you can reach out to both of us on social. Xiaojue, thank you so much. Do you have any final messages for people who maybe are sitting with a lot of questions about this in terms of, wow, I had an experience, I'm not sure what to do, or maybe, I've had a lot of trauma and I haven't been able to access it. I guess one message is be patient, but do you have other thoughts for individuals who want to learn more about this or get more involved in making this part of their treatment over the next few years?
Yeah, I mean, I would say, pay attention to how you feel about psychedelics. I think feelings are a really important GPS for us. And, for some, they're not really for everyone. For some people, it might be too much. Maybe for some people, like with unresolved trauma, like you said, it may not be, maybe they're not ready to go in there or something. And so if you're not really feeling it, like you don't have to push yourself just because it's like the new trendy, treatment. But if you are interested, definitely, you can get in touch with us. There's a lot of resources out there to kind of educate yourself. Yeah.
Well, I really love that message also, because I do think with the buzz, it feels like a silver bullet. And I think when we're struggling with depression or PTSD or mental health conditions or addiction, like we want that silver bullet. But I think thinking of these, as you said in our prior video, about is a really powerful tool. So the setting, the set and setting make a huge difference. And also the practitioner makes a huge difference, of someone who's experienced that these aren't things, both out of respect from where they come from, but also out of respect for the power of their neurobiological activities. They're not compounds to be taken lightly. There's a lot of new research coming out. We'll be reporting on that. And Xiaojue, as usual, it's just great to get to talk with you and hear more about this and share your expertise. Everybody, thank you so much. Make sure and subscribe, and we'll be back to you soon with more information about mental health. And make sure and do something, take care of your mental health today. We'll see y'all soon.